Okay, our next presenter is Dr. Rowaida Saad in a presentation entitled A Horse or a Zebra. So Dr. Rowaida is a demonstrator in pathology and Faculty of Medicine at Alexandria University. Dr. Rowaida, are you with us?
Could you hear me? Could you hear me?
Yes, Dr. Rowaida, I can hear you. You started sharing your screen. Okay, it appears in front of me right now.
Okay. Hello everyone, my name is Rowaida Saad, Demonstrator of Pathology at Alexandria Faculty of Medicine. First of all, I'd like to thank Professor Dr. Iman Abdelzoher, Professor Dr. Saad and Dr. Inez Zaki for such a great opportunity. My talk today is under the title, A Horse or a Zebra. The first case is for a 33-year-old male patient complained of right ring finger swelling since 7 years. The clinical diagnosis was giant cell tumor of tendon sheath. Excisional biopsy was done, and biopsy was sent for pathological examination. The received specimen was in the form of multiple pearly white fragments. Microscopic examination revealed a circumscribed plexiform lesion showing hypercellular central nodules surrounded by less cellular higher magnification on the hypercellular areas
Your voice is not clear.
revealed areas in the form of spindle-shaped cells, with the areas revealed neurofibroma-like areas with common myxoma, peripheral nerve sheath tumor with hybrid features, and histiocytoma. Immune histochemistry for S100 accentuated in schwannoma-like areas and the same subset of cells in neurofibroma-like areas. With only focal positivity in schwannoma-like areas. Formed only Schwann cells, so S100 is diffusely positive in schwannoma. The positivity for CD34 should be limited only to the periphery of the tumor. Fibroma is formed of admixture of cells, Schwann cells, perenurial cells, and fibroblasts. So S100 is focally positive. CD34 has a characteristic lattice-like staining pattern. Going back to our tumor, we have a plexiform lesion with dual morphology on H and E, with central hypercellular nodules surrounded by less cellular areas. Do you hear me?
Yes, doctor, but your voice is flickering and sometimes it's muted. And you have to be careful
Could
for
you hear
the
me
delay.
now?
Yes.
Could you hear me
Yes,
now?
I can hear you. Yes, I can hear you, doctor.
Going back to our tumor, we have a dual morphology H and E, showing central and CD34 was positive. S100, the same subset of cells in neurofibroma-like areas. CD34 was accentuated in neurofibroma. This hybrid morphological and immunohistochemical pattern cannot fit with either schwannoma or neurofibroma, as it contains features of both of them. So the case was signed out as. Could you hear me now?
Yes, your
Could
voice
you hear
goes.
me?
Yes. Yes, now it's clear, but sometimes it is flickering.
Okay. This hybrid immunohistochemical and morphological pattern cannot fit to either schwannoma or neurofibroma, as it contains features of both of them. So the case was signed out as benign peripheral nerve sheath tumor with hybrid features, hybrid schwannoma and neurofibroma, and it was a zebra. The second case is for a 17-year-old male patient complained of right ankle subcutaneous lesion. Excisional biopsy was done, and the biopsy was sent for pathological examination. Microscopic examination revealed a circumscribed lesion formed of spindle-shaped cells with fascicular and word architecture and subtle palisading of the nuclei. Focal nuclear atypia was noted. Differential diagnosis includes schwannoma, neurofibroma, soft tissue perineuroma, and palisaded encapsulated immunohistochemistry for S100, CD34, EMA, and neurofilament protein. S100 shows significant activity in most of the tumor cells. Significant positivity for S100 excluded dermatitis and raised the neural nature of the tumor. But continue of the tumor cells, excluding the possibility of schwannoma and raising the possibility of neurofibroma. Neurofilament protein was completely negative, excluding the possibility of neurofibroma and palisaded encapsulated neuroma. Palisaded encapsulated neuroma was our first differential diagnosis regarding the subcutaneous location of the tumor, its circumscribed nature, the subtle nuclear palisading, and the diffuse positivity for S100, but negativity for this. To complete the panel, EMA was done, and it showed focal significant positivity. To summarize, we have a subcutaneous lesion, circumscribed, formed of spindle-shaped cells, arranged in fascicular and word architecture. S100 was positive, CD34 was positive, neurofilament protein was negative, and EMA was focally positive. This immunohistochemical pattern cannot fit with any of the benign neural tumor, and the possibility of hybrid neural tumor is raised. Schwannoma is formed of Schwann cells, showed diffuse positivity for S100, positivity for CD34, neurofilament protein and EMA should be restricted to the periphery of the tumor. Neurofibroma is formed of admixture of cells, Schwann cells, perineurial cells, fibroblasts. So S100 is focally positive. The CD34 has a characteristic lattice-like staining pattern. Neurofilament protein and EMA should be positive. Perineurioma is formed only of perineurial cells, so it's S100 negative, neurofilament protein negative, and positive for both CD34 and EMA. The positivity of our tumor to S100 raises the possibility of schwannoma component in this tumor. The complete negativity of neurofilament protein excluded the possibility of neurofibroma. The significant focal positivity for EMA supported the presence of perineurioma component. So again, we are facing another hybrid tumor, but now it shows features of both schwannoma and perineurioma. And the case was signed out as a benign peripheral nerve sheath tumor with hybrid features, hybrid schwannoma and perineurioma. And again, it was another zebra. Benign peripheral nerve sheath tumors are classified as neurofibromas, schwannomas, and perineuriomas. This trichotomy has been challenged with identification of tumors containing dual pattern of differentiation, so-called hybrid tumors. Schwannoma perineurioma is the most common form, followed by schwannoma neurofibroma. Neurofibroma perineurioma is the least common. Hybrid schwannoma neurofibroma. Most of these tumors exhibit a plexiform architecture and represented by a variable combination of neurofibromatous and schwannomatous areas. They often show a predominant neurofibromatous, those myxoid areas at the periphery, surrounding a central hypercellular schwannomatous nodules. So they can be defined as plexiform neurofibromas with schwannoma-like nodular proliferation. Most tumors are associated with different types of schwannomatosis and less frequently with neurofibromatosis type 1, but they are not confined to this type of patient, and those tumors are reported in patients with no stigmata for these syndromes. Hybrid schwannoma and perineurioma. They are benign nerve sheath tumors showing predominantly Schwannian cytomorphology and perineurioma-like architecture. They are composed of admixture of both cell types. These tumors usually arise in dermis and subcutis and occur over a wide age range and anatomic distribution. Hybrid schwannoma perineurioma is frequently characterized by recurrent fusion event, including VG-LL3 rearrangement. This finding can be exploited for diagnostic application when classification is not readily apparent based on morphology or immunohistochemistry. The presence of this discrete molecular event implied that these neoplasms, despite being hybrid, they represent a distinct entity with a molecular pathogenesis altogether are related to schwannoma and or perineurioma. Hybrid schwannoma perineuriomas have no evident association with neurofibromatosis and they rarely recur. Differential diagnosis includes other benign peripheral nerve sheath tumor, but in mind that the composite nature of these lesions could be easily overlooked if only limited immunohistochemistry is performed. Low-grade malignant peripheral nerve sheath tumor, as nuclear atypia, could be seen in the hybrid tumor, but increased cellularity and increased mitotic activity is generally present in low-grade malignant peripheral nerve sheath tumors. In difficult cases, immune staining for H3K27 trimethylation can differentiate between the malignant and benign entity, with loss of immune staining in the malignant entity. Take-home message. Benign peripheral nerve sheath tumor do exist. They are tumors exhibiting areas of more than one neural differentiation, such as schwannoma neurofibroma, neurofibroma perineurioma, and schwannoma perineurioma. The composite nature of these lesions could be easily overlooked if only limited immunohistochemistry is performed. Most hybrid benign peripheral nerve sheath tumors seem to follow a benign clinical course with only rare recurrence and malignant transformation.
Thank you so much, Dr. Rowaida, for your excellent presentation. Thanks so much for your supervisors for this great effort.